Which of the following penicillins can be given by IV route? Benzathine, procaine, crystalline, all of the above. These penicillins you have to know because they are one of the most common drugs that we use for gram-positive spectrum. And there are different types of penicillin, and we will learn the routes of administration and the dosage for few important types of penicillins. Okay. Initially, this penicillin had a very narrow spectrum, that is gram-positive spectrum. In that, we had a variety of classifications. Okay, where we had to learn about few more penicillins. Okay. So, we have beta-lactamase sensitive. They are nothing but natural penicillin, the initial days which we used. Under that, we have acid resistant and acid labile. Okay. I'm just telling all this because everything can be asked as an MCQ, which is acid resistant. So, acid resistant penicillin is penicillin V, oral. This is oral route of penicillin, penicillin V. In acid labile penicillin, you have three different penicillin. One is penicillin G, which is known as benzyl penicillin. Benzyl penicillin, this is IM and IV. Okay. Then you have procaine penicillin. This is IM, and you can have depot injections. Okay, depot. And you have benzathine penicillin. Benzathine penicillin, which is, this is also, everything is G type. Okay, so this is also IM and depot injection. Depot. So basically, acid resistant and acid labile penicillins you have. In penicillin, acid resistant, you have penicillin V, and here you have penicillin G, procaine, and benzathine penicillin. Okay, another one thing, you have beta-lactamase resistant. So which is very similar to, so the other spectrum is beta-lactamase resistant. In that we have acid resistant, again acid labile. Okay, in this acid resistant you have some drugs called cloxacillin, dicloxacillin, and flucloxacillin. Okay, cloxacillin, difloxacillin, flucloxacillin. Then acid labile you have methicillin, which is given by IM and IV, and you have nafcillin, which is also given by IV and IM. So why this pharmacokinetics of penicillin is important is this oral administration of penicillin G, right? It was acid labile. So about 1/3 of orally administered penicillin is absorbed from your intestinal tract. Okay. So the penicillin is derived from your fungus, right? So the gastric juice at pH rapidly destroys your antibiotics. Okay. This parenteral administration, your IM site, from your IM site, the absorption is very rapid and it is complete also. Your peak plasma level is attained in nearly 30 minutes. Okay. So imagine your peak plasma levels are attained in 30 minutes. Other things that you have to know regarding penicillin is, see, benzyl penicillin, they have an incorporated sodium and potassium salts in it. Okay. Again, we have some repository penicillins. Okay, insoluble salts. So you can never give IV injections. You can only give IM injections. Then you have procaine penicillins and you have benzathine penicillin. Okay, you have benzathine penicillin. Now we will learn the mode of route of administration of all this. Basically, your benzyl penicillin or penicillin G. Penicillin G is given by, it's long acting, it's a natural penicillin. It is given by IV, preferably IV. Your benzathine penicillin is given by IM. Your procaine penicillin is given by IM. Okay. Phenoxymethyl penicillin. This is penicillin V. It is acid resistant, so it's an oral. Amoxicillin, we give it IV and oral. Okay. Ampicillin also we can give it IV and oral. Why I told amoxicillin and ampicillin is these are the most important drugs that we use in a clinical, day-to-day clinical practice. So we come to the doses. This crystalline penicillin, you have to know the dosage. It is given 0.5 to 5 million units IV or IM. Just know only the dosage, that is important. Benzyl penicillin 0. Basically, most of the penicillins you will have 0.5 to 1 million units. Okay. Only for this benzathine penicillin, we have 0.6 to 2.4 million units, and it has a longer half-life. Every 2 to 4 weeks as a aqueous suspension. It is effective for almost 4 weeks. Rest are all you can give a day once, like 24 hourly. Okay. So coming back to the question, which of the following is given by IV route? Your answer will be crystalline penicillin, because this only can be given by IV. This too can be given by IM and IV both, but which only can be given by IV route is crystalline penicillin. I hope this is clear. You have to know the routes of administration, why, what is acid resistant, what is acid labile penicillin, what is extended spectrum of penicillin, how much hourly doses, and know the dosage only for these three things. Okay.